Wolfpack Wellness is presented by UNC Health, official healthcare provider of NC State Athletics.
The issues that you can have with your feet and ankle, they could be congenital, things you were born with, but most of the things that people struggle with are soft tissue injuries, and even more simple than that, finding shoes that fit. That means having an appropriate amount of room in the toe box or the front of the shoe, a stable heel counter, and an appropriately supportive shoe based on your arch type. Everybody has a different foot type, and you want to try to find a shoe that fits your foot type best. For most of college athletes and college athletics, the number one issue that you're going to have, orthopedic injury you're going to have, is an ankle sprain. That's the most common overall that we see, and the data shows that. But for our distance running athletes and for track and field athletes in particular, we see more overuse injuries, what we call overuse injuries, and that's just from repetitive stress over time. We have athletes running 50, 60, 70, sometimes 80 miles a week. And so you get more of your tendinitis, your plantar fasciitis, which can be really problematic, and the classic stress fracture or stress reaction from overuse. So the plantar fasciitis is, like the name indicates, it's an inflammation. So whenever you hear itis, that's inflammation of the sort of bottom covering of your foot. This sheath of tissue on the bottom of your foot is your plantar on the bottom fascia, right? So that inflammation usually occurs when there's an injury to the tissues underneath, and then what happens when you sleep at night is that your foot is pointed in a shortened position, those tissues get tight, and then when you step in the morning, the tissues that have now healed or built almost scar underneath your foot, you now break that tissue up again, start the inflammatory process over and over and over again, and so it becomes this cycle of injury and inflammation that leads to significant dysfunction and pain and discomfort. So a stress fracture, again, is another overuse injury. We think about fractures, we think about breaks in the bone, we think about big traumatic events, not realizing that we actually absorb tons of micro traumas to our lower extremity all the time. The stress fracture, unlike the sort of traumatic fractures that you see in sports a lot of times, is something that gradually occurs and it gradually progresses, and it may not even show up on radiographs, it may not show up on x-rays immediately, but over time you start to see this response in the bone that the integrity of the tissue is diminished, and you see a break in the bone, or you might see a hairline. You may hear hairline fracture along the bone that needs to be addressed. Turf toe. It's essentially a hyperextension of the big toe. So the big toe, though all of the structures within your foot are very important, your big toe is your major lever, one of your major levers for propulsion and for movement. And what happens is this joint that is very flexible, but it has a limit to its range, and you move past that range in extension. And so you damage the structures that keep the toe together on the underside here, and that can cause all sorts of tissue damage, even fracture in some cases that need to be addressed. And in some cases, there are some surgical options that might need to be employed, but we try to avoid those if we can. We all experience some level of discomfort when we exercise, and that's actually necessary for our bodies to adapt and maintain health. But when we see prolonged or intense pain, that's usually a sign or signal that we shouldn't ignore. Our body is telling us something, and we just have to be smart enough to listen.
Find more information at unchealth.org/sports.